Yes, ladies and gentlemen, welcome to today's session, Psychology in the U.S. Healthcare System. This workshop offers a practical overview of accessing mental health, understanding health insurance services in the United States, finding culturally competent providers, and learning about immigrants right within the healthcare system. This program is made possible with the support and sportsmanship of Wake County, and we sincerely appreciate their valuable partnership. We are honored to welcome Ms. Grace He as our instructor today. She is a licensed mental health counselor specializing in cultural sensitive care for Asian, immigrant, and refugee communities. We hope for experience and insight will be helpful and empowering for all of us. Thank you for joining us, and we invite you to engage actively throughout the session. Now, let us begin.
Hello,
Miss Grace.
everyone. Well, such an honor to be here and um, introducing the healthcare resources in United States for to everyone. And first of all, I want to take a survey. Is everybody in US? Because my resources is all based on US resources.
Somebody
Yes,
from
ma'am.
other countries, but you are
Yeah,
going to cover Wake County.
Yeah, we
Don't
can
worry about it.
understand English.
Okay. Yeah, I'm counting because I know this is going to be recorded and over you're going to put it YouTube and therefore um I'm basically the resources I'm going to talk about is the whole United States. Okay. All right. Um Today we're talking about mental health. I know a lot of people when it comes to mental health, people may have different thoughts and opinions. And can I invite everybody, if you like, put in the chat box, when you think about mental health, what comes to your mind? What do you think mental health is? And you don't have to define it, just anything come to your mind when you think about mental health, that'd be great. Just type it in the chat box. I'll give you 1 minute and we'll see. Okay, let me read. Okay. Psychologist for talk therapy, a psychiatrist for meds. Wow, wonderful. You know, very knowledgeable, Sarah. And chapeau, mental health, something that gives you unrest without a reason. Yes. And mental health is your emotional and psychological well-being. Wonderful. Okay. Very good answers. Actually, there's no wrong answer. I just want to get to know you better. So I can tailor the needs to tailor my what I have to say specifically to your needs. And so I would like to first to check. Uh, I, would you like me to leave the Q&A till the very end? Leave your question till the very end, or you prefer to ask question as we go?
Up to you. Anything is
Okay. So how about
easier
I'll
for
I'll
you,
stop
possible?
here. I'll stop periodically for questions, and in the end, we'll have a large Q&A. And whenever you have a question, feel free to type it in the chat box. And so I pop when I once I share my presentation, I wouldn't pay attention to the chat box. So, like, dear host and hostess, you can stop me if you think there is something very relevant and critical. Otherwise, I'll just stop periodically and see that then the host and hostess can share the questions. I can read the questions out loud. Okay? All right. So let me share my screen. Oh, I cannot do this share yet. I need to share first and then the presentation mode. Okay, can everybody see my screen now?
Yes.
Okay, all right. So let me do the presentation mode. Okay. Today we're talking about understanding mental health in the United States because all the resources and the definitions and I'm talking about is the United States. Okay, so jump too fast. All right, the next, the objective. What we're going to learn today, we're going to understand what mental health care is in the U.S. and reduce the stigma and identify affordable mental health services that you as immigrant are eligible for. And understand basic U.S. health insurance terms and options, and find culturally and linguistically competent mental health providers. Know your rights as immigrants as when you seek health care, and if there is a crisis emergency mental health, where to find the support. Okay. And so first of all, what is mental health? All right, mental health is how we feel, think, and handle stress. I think some of you answered very well. And so mental health include like stress, sadness, worry, and have trouble feeling overwhelmed or tired. I think, it is just like physical health. It can change over time. And ask for help is not weakness. Just like every day you may get a cold, you may get a flu, your emotion can get a cold, get a flu, and nobody is 100% of your capacity all the time. Therefore, ask for support is not weakness. And just how much we care about our physical health, like people go to gym, we exercise, we talk about what's the healthy diet, right? We try this diet, that diet to optimize our physical health. Same here, we can talk about the more we talk about mental health, the more educated we are about how to keep us at our prime condition. And we can do like a mental health exercise, mental health maintenance, mental health, like what's the best lifestyle for mental health. And when you uh like need help, where to get help and what kind of help is best for you in that specific condition. Okay, so go next. Because we are immigrants, right? I myself is an immigrant too. So immigrants have other, in addition to everyday stress that everybody experience, that for immigrants, we experience specific stresses, like first, how we get here, that experience, how we get to a foreign country, that is itself could be stressful. I have talked to someone who have been through violence and dangerous crossing, and those could be traumatic. And then even if the immigration journey is smoothly, and then once we come to a new country, inevitably we're going to experience disruption of family and community bonds, right? You could be away from your loved ones and be away from your friends and be away from a system that you are very familiar with. Once you come to a new country, everything's new. Just like why we need to talk about this mental health resources in the United States, because we didn't grow up in this country. So we don't know how the health system in the new country runs. Okay, of course, we have language and the culture hurdles. The language is like if you are United States, then English is the primary language, and therefore we have amplified feeling of helplessness and chronic stress. And of course, the social economic disparity. when we're new to a new environment, we have to build everything from scratch. That from the very beginning, we are already at a disadvantage status because all the people, vast majority of people around you, if you're a children, then your classmates, they are at social economic advantage. If you're working, your employer or employee, your peers, or people competing with you in the job market, they all have a disadvantage, have advantage. Therefore, you have a disadvantage. All right, and then not to mention we have discrimination. Discrimination is inevitable. It could be like outright discrimination, which like fortunately in modern society, the law as the United States, the law prohibit the outright discrimination. But inevitably, it's here and there. And some people even aren't aware of it. You may experience something we call microaggression, like linguistic prejudice, we already talked about, right? So people will say, "Oh, I cannot understand what you're talking about because we have accent." And so it's inevitably each one of us experience like racial and ethnic bias, right? And I know some children, they are afraid to eat lunch with their peers because their peers, like, sometimes children could be brutal. They will say, "Oh, your food is so weird." Yeah. And religious intolerance, right? People will say, "Oh, what's your faith?" It's like, I have never heard about it. And therefore they have, and also we recently I'm volunteer for UCA Waves, and UCA Waves basically is cooperating with Wake County, and that's how I'm here because through UCA Waves. The UCA Waves recently produced a documentary film called Breaking the Silence. It talk about mental health. And one of the stories, it's real life story, real people it showed up in that documentary, is they their religion after like 9/11, people were scared about them because when they see them, they dress differently. So then the people in the United States would just equal them to terrorists. Yeah, even though they have nothing with terrorists, but the stigma is everywhere. The bias and discrimination is embedded here and there. And immigration status stigma, like these days, you probably saw the news, the deportation. And there are people, like if you look different from the mainstream, you could be forever foreigners. And people will say, go back to your country. Those are all real examples. Then I have people came to me and says, "Hey, I was born in this country. United States is my country." Then people in the street will say, "Go back to your country." He said, "This is my country. There's no second country I go to." So these are all the discriminations people experience in here and there. It's inevitable. So that's extra stress for immigrants. All right, the next is we really need to know, we need to be aware, like stress response are normal. So when be confronted with the adversity, physiological arousal, that's just a very big term. So plain language is if you feel stressed, if you feel overwhelmed, it's normal. That's the body protection system built in our gene. We all have that kind of reaction when there's stress. So therefore, when you feel like down, don't feel bad. There's nothing wrong with you. It just your body is built that way. When you are like stressed all the time, then your body break down. Just as think about it, if you work hard without a good rest, without a sufficient rest, you're going to have physical health. Then if you're emotion, your nervous system is stressed all the time, is going to have health issue too. And therefore, when you have issues, it's not a personal weakness. Experience of frustration, embarrassment, or feeling of unheard, unseen is expected outcome of systematic pressures. It's not evidence of anything wrong with you. And you are not alone. So you'll be surprised at how so many people are not at their prime mental health condition. It's just someone has more intelligence, have the mental health intelligence to seek help early. Some people and some community have strong stigma. Those strong stigma would prevent us seeking help timely. So then when we have to seek help, sometimes it's already too late. So just think about the physical health. You don't go to see a doctor until you have a cancer, right? You don't go to see a doctor until like it's a life-death situation. When you see something's wrong with you, immediately you go to see a doctor and check it out, and they call it early prevention. So for mental health, same. Early prevention is very important. All right, so there are different kind of services, mental health services in United States. So there's a counseling that's they basically it's talk therapy. I think some of you typed in the chat box. It's talk therapy, and they use evidence-based modalities, and those are delivered by people that have sufficient training. So they are trained by up to the United States standard. So the good thing about United States is it's highly regulated. So that means uh, the government is doing the quality control for you. As long as it's licensed, then you should feel pretty safe. You are in good hands. And you can feel free to change. If you see therapy, so you receive a counselors and somehow I didn't feel helped. Feel free to change. And so I have the experience of people like change several therapists before they found one that really fitting their needs. So so first of all, you should feel safe in that that licensed therapist. There are several license. You it's probably um, a lot to keep track of. Like their title could be psychologist, their title could be social work, their title could be counselor, their title could be a marriage and family counselor and art therapist. So as long, I think that it's the easy way for you to verify. You just say, are you licensed? And ask to see a copy of their license, that you're pretty safe. Because if they practice beyond what their license qualify them for, you can report to the board. Just like you're dealing with every profession, you are protected by the regulation of that profession. Okay, then the next is psychiatric medication management. So this one, you not just talk therapy, but also you receive medications. Again, there are several licenses could prescribe medications. You don't have to know what those licenses are because there are a variety of licenses. You just ask them, are you licensed to provide medication to prescribe? If they say yes, then you get their prescription to any pharmacist, like a big pharmacist. Then the pharmacy would again verify for you because they would verify whether this is qualified prescription. If it's a legit, then the pharmacist will give you the medication. Okay, and so the training here is even more um, more rigorous because when it comes to pharmacy, there could be side effect, and there could have to be integrated with the psychotherapy for complex affective disorders. All right, then these two, the first two, like they are highly trained. They're provided by highly trained clinicians, and therefore it comes with a cost. Hopefully, you have insurance cover the cost, because otherwise the cost could be a hurdle. So there, I'm going to talk to you about some low cost and free resources like this peer support gathering. Peer support gathering is hosted by individuals who lived similar experiences. Like they themselves could experience anxiety, they themselves could experienced depression. Therefore, it's called peer support gatherings. So they normalize the emotional reactions and co-create coping strategies, because basically they have been there, done that, and therefore they can help you and help each other with their shared life wisdom, shared life experiences. And mental health clinics. Community mental health clinics, usually it's public or nonprofit facilities that offer in-person services. So that often come with either no cost or sliding scale fee structure. Well, that's a big term by reduced cost. And next, oh, let's see. Next is like we need to understand that the insurance system, because as I said, the more advanced care you receive, the higher the cost, and therefore insurance would be very important, because then you don't have to pay as much out of your pocket. And insurance, it's complex, especially U.S. insurance is it's even complicated for U.S. citizens who was born here and grew up here. And we may have affordability concern, and there we could have misinformation about the impact of healthcare on their legal status. So we may say, oh, if I see see of healthcare, does that mean that my chance of deportation is higher? So those are misinformations I'm going to address later. Let me see. Next page. Okay, so the best is employer-sponsored healthcare plans. So because why is best? Because it's group insurance, so it's a group insurance rate, and also it has higher benefit and better benefit and less money out of your own pocket. And it also it includes the mental health parity provisions. So again, it's a big term. Big term basically means it's tailored for your needs. A lot of if you are working, you can check your employer. They probably provide something called EAP, and that is free. And usually, most of the EAP or employment system program comes with free mental health counseling, which is talk therapy, several times. So the employer's program varies from employer to employer, so you may want to check out. Like iPhone 1, when I had my EAP program, like employment assistant program, I didn't know what that is. I used zero. So I enjoy that benefit. I had that benefit for like 18 years, but I used it zero times, because at that time I was not as knowledgeable about mental health as I am now. And therefore I am passionate about giving this workshop. I hope each one of you, if you have employer-sponsored health plan or any benefit, you could take full advantage of that. Okay, next is Affordable Care Act marketplace offerings. So this is a term used in the United States. If you have that insurance, you will know what I'm talking about. So that's the insurance name is called Affordable Care Act. Okay, that means you don't have to be employed. Any individual, you can purchase plan directly with subsidies tailored to your income. So that means if you're low income, the insurance premium will be subsidized by the government. So the purpose of this Affordable Care Act is to ensure, regardless of your economic condition, regardless of your health condition, you could have like precondition condition. Use a small term, simple term. That means if you're already sick, like I could have high blood pressure before I join this Affordable Care Act insurance, the insurance cannot disqualify me just because I already have high blood pressure. So this is what this act for. Okay, so and this covers crisis services. Crisis service means like if you're in health emergency, both physical emergency and mental health emergency, it's covered. All right, then next is Medicaid. Medicaid is state run. So this one, it may require state residency and some require your legal immigrants. So, and therefore not everybody qualifies for this Medicaid, but I will strongly suggest you to check it out if you feel safe with your immigration status. Because this is public insurance and it provides a large variety of care, and it works very well. It's even provides if you're in need, it even provides transportation. They will drive you from your home to see a doctor. So it's a very good program, worth check it out. And then the next is community health centers and safety net clinics. So it's usually run by nonprofit facilities that provides sliding scale fees. Again, that means either care for those have low income and have language assistance and culturally attentive. That in the simple word is they're compassionate about your culture. Later, I'm going to talk about what is culture attentive, and it provide language assistance. Basically, almost every health resources you can ask for translation. Some may provide translation service, some may not, but it's always helpful to ask for it, especially for government-run program. They usually have pretty good translation service. And the community health centers, their resources could be limited, but if you find community health centers that's tailored for your needs, like could be Persian community health centers, right? Could be like refugee community health centers that's tailored for your needs. You'll find that probably more helpful than the cookie cutter for everybody in the society. So far, any questions? I cannot see the chat box when I'm sharing my.
There are many questions in chat box. If you can,
If
you
there are
have
many
time.
questions, we can
Yes.
probably save to the end. Or if you think there's one or two I can answer right now, feel free to read out to
Yes.
me. Yeah.
Yeah. You can check and answer any question you believe that's most useful for everybody.
Because when I share my slides, I cannot
Oh,
read the
yes.
chat. Yeah.
Okay.
I have to stop
In
sharing
the
to read.
paper. Yeah.
Charissa,
In the
would you choose some questions, two questions, and ask Grace?
Yes.
Go ahead.
I have question here. What are the mental effects when people experience discrimination so often that they start seeing it as normal and no longer realize it is hurting their mental health?
Yeah, it's unfortunate. As I said, discrimination is like sooner or later, here or there, we all experience that in certain form. Some discrimination is intentional, some discrimination is unintentional. So the law prohibits discrimination. So let's say if your employee, you experience the discrimination at workplace, then you can report to HR, and that need to be stopped immediately and penalized immediately. But think about it. If you're a child, right? If you're 10 years old, you're discriminated by your classmates. Another 10 years old. You can do a report to teacher, and the teacher will educate the 10 years old. But how soon will the other 10 years old correct their behavior? It's a big question mark. Because some children would correct immediately, some children would not. That's any one of us children we will know. And some could be, I have the cases, they got discriminated by homeless in the bus. And so then the discrimination wouldn't put this homeless to jail. And therefore, the best is we help ourselves. So basically it's like in the physical world, right? We stay away from virus. We can wash our hands and keep personal hygiene and make exercise, build up your immune system. So this workshop is about like build up your immune system and and once you're sick, where to get help. Does it make sense? So basically, in short answer is report to the authority. The authority, if a school, could be teacher, if at work, it could be HR, your boss. If in the community, you can report to the police. But usually for this discrimination, the police wouldn't really act upon it because it's not serious enough. Make sense? Mhm.
Yeah, yeah, it makes sense. But how come others, some other that they already tolerate this kind of behavior?
Uh, who are those others? Could you give me example? Oh, you're muted. You're on mute.
No, I've seen a lot, especially in the SOCMED, that social media, that there's a lot of bullying. So some people also normalize like that.
Mm-hmm. Mm-hmm. Because as I said, the the policeman wouldn't do anything, even though it's illegal, but it's a small thing. Like if you say somebody stole $1 from me, the policeman wouldn't do anything, right? Somebody stole $10 from me, the policeman still wouldn't do anything. You say somebody stole $100 from me, the policeman may record it, put in their record, but the policeman wouldn't go put that person to jail. And so same. And the social media, I think some platform say they have their censor, right? Like before, like Facebook and Twitter, both at the now it's no longer Twitter, it's X, but at the Twitter days, they do have censor, but the censor is hard to cut the line. Sometimes the sensor could be here, sometimes sensor could be here. Like, for example, like several years ago, there was when the Israel and Palestine conflict show up, and there are strong voice on the social media. Some support Israel, some support Palestine, and those support Israel will say those support Palestine is bullying, and those support Palestine will say those support Israel is bullying. So where to cut it? And people have different opinion. And some draw the line here, and then this group of people will say, "Oh, you're discriminating against me." Some draw the line here, and this group of people will say, "You're discriminating me." Even though they draw the line here, and they still will say this group of people will wish the lines here, or this group of people will wish lines here. So it's hard to draw the line, and because of the social media, it's anonymous. They can create an ID. That's why as a mental health professional, I would suggest that those parents keep your children away from social media as long as possible. If they have to have social media, make sure give them enough vaccine. It means educate them, because the social media, anybody can create a fake ID there. So that means like a mask. If nobody knows who you are, there are a lot of violence on the internet.
Great, great. Thank you.
Okay, so we answered one question. There's another question, right? So,
The second question, why do some people choose therapy while others prefer medication?
okay, yeah. So it's personal choice, first of all. You can choose to have it, and you can choose not to have it. And it's a personal preference. Um, I am a talk therapist, so what I have to share could be biased. Take it. So, but medication um, is what I see in medication is work on the chemical imbalance in you. So, so if you are depressed for a long time, for example, some of your chemical is in your brain, or I put it this way, if you are stressed for a long time, then some of the chemical in your brain can be consumed, so it's low. Then the medication would replenish it. So it's back to the normal level. And the talk therapy is to slow down that consumption. Does it make sense? It's just like if you take it as a bank account, right? So you should have it's not good analogy. So blood pressure. Blood pressure. To take medication, if you already have high blood pressure or low blood pressure, you take medication to keep it at normal range. And talk therapy is like to help you maintain a healthy lifestyle. That could lower your blood pressure too. But if your blood pressure is too high, then medication is necessary. Does it make sense? Uh-huh. And at the same time, even when you take medication, it's still helpful to have talk therapy, just like your physical health. You have high blood pressure, you can keep taking the medication to manage your high blood pressure. But if at the same time you don't change your lifestyle, that's still not the primary treatment to your high blood pressure. Does that answer your question?
Yes, thank you, thank you.
Okay. All right, good. All good questions. Thank you. All right, so we can move on to the next slide. All right, so what I'm going to, this is the insurance, right? We talk about the employer. If you have the employer sponsored health program, you can go ask your employer, ask the HR, and they will give you because every insurance plan is different. But the next affordable care is it's standardized. So I'm going to talk more about that. Like market plans, it's also called affordable care. So that those two terms are similar. So that first of all, it's individual enroll model that you can directly select a plan that fits your budget with the option to add supplemental mental health riders if you desire. And then this have all this market care, affordable care plan. This plan, they must cover like psychotherapy, and there's no cost discrimination when it comes to psychotherapy here. Psychotherapy basically means mental health. All right, and eligibility, it means the subsidies are tailored to your income and relative to federal poverty line. So that means the lower the income, the more attractive you'll find this to you. All right, the certain immigration categories have a limit. And in other words, certain immigration categories qualify for this. So you need to be careful before you check it out. You can, yeah. I think check out with the community probably is the best. And then emergency coverage is even when you enrolled because one day or another, because it still costs money, right? If you say, oh, I don't fully enroll that to save my cost, it still guarantee you of emergency mental health services to prevent care gaps during crisis. So it's, in other words, if there's any emergency, feel free. So what is emergency? Basically, is anybody's life could be threatened. You could say, I feel my life is threatened. In other words, I feel so down and so depressed that I'm very concerned about myself, just like a medical emergency or like a physical emergency. If you're very concerned, you go to an emergency care clinic and have yourself check out. Mental health is the same. You can step into any emergency care clinic. They will assess you, evaluate you, and then decide whether they need to keep you there or give you medication or transfer you to another facility who can provide you a better care. The next slide. All right, the community. The community clinic, they provide a sliding scale that, in other words, they would probably have provided lower cost service for you. And they usually provide multilingual interpreter services. Especially if you find your like the community you're very familiar with, like a Persian community, right? And the community care, the good thing is they don't ask about your immigration documentation. So they don't ask, are you a legal immigrant here or are you illegal immigrant here? So the nonprofit clinics, there are special clinic that just providing their service tailored for immigrants and refugee communities. There are specialized program offer culturally specific mental health curricula. And so you need to check that out in your community. All right, so next, finding that culture competency provider. So what does it mean? It does not have to be someone that speak your language or come from the same country you're from. And so the criteria, number one, they respect your culture framework. They respect your religious framework. They can integrate their care to your needs, to your culture, to your spirit practices. And number two is language congruence, and they can provide interpreter services. And number three is gender-specific providers. Like some culture, if I'm a female, I feel more comfortable talking to a female, right? You can specifically ask for male provider or female provider. Or you can check, let's say if I am a Christian, I will say I only feel comfortable with a Christian provider. That's fine. If I'm a Muslim, I will say I'm only comfortable with a Muslim provider. That's fine. There are a lot of resources for you to check it out. Okay, and the next is free interpreter services as standard practice. Many health systems have free interpreter services. It's just some interpreter services cover few languages, some cover many languages. So you need to check out. I think the most popular here is Spanish, because you probably know that the US, there are a lot of Spanish speaking. So therefore, check out your community. Your community probably provide more of these things that's specific to your needs in your community. Right. Next, how to find providers. Okay, so first, leverage community health center networks. Basically, ask your friends nearby and visit a local federal qualified health centers. And the staff can refer you to psychologists, psychiatrists, social workers. So these are the three names I mentioned, right? Those represent a certain license, but not limited to those three licenses. Psychologist is someone who will receive a PhD level education. Psychiatrists receive PhD level education too. Psychiatrists, their main function is prescribe medication, and they do talk therapy, but to a minimum level. They don't do talk therapy too much. And the social worker, they receive a master level education, and the social workers do talk therapy, but they cannot prescribe medication. And the social worker can connect, like when it comes to child protection, like if elder protection or like women protection. So in other words, if you feel like you're threatened, like if people are concerned the child is abused, that's when usually a social worker step in. But these are just the three kind of licensures. There are way more other licensures can provide the same healthcare that approved by the law and the regulations. Okay, the next is contact your ethnic immigrant advocacy groups. I think those probably you know who they are. And then engage faith-based leaders for referrals, because a lot of people, they trust their faith-based leaders more than like probably a strange healthcare providers. So therefore, if it's referred to you by your faith-based leaders, probably will feel safer and more comfortable there. And then you utilize vetted online directories. I'm going to provide a long list of other things. I'm just listing here several, but there are other resources like Psychology Today. It's a website that's a directory of mental health providers all over the United States. You can filter by country. You can filter by state. You can filter by specialty, gender, faith, religion. You can filter everything. But it's pay. You don't have to pay as a user. You don't have to pay, but for the service provider, they have to pay. Therefore, not 100%, not all the service provider is listed in this Psychology Today. And then there's National Alliance on Mental Illness. A nickname is NAMI. You would hear NAMI more often than hear the full name, that National Alliance on Mental Illness. and they can help you, refer you to the local resources. And you can go to your state health department and like you can do your county. Like this workshop is possible thanks to Wake County of North Carolina, right? So if check out your county website too. The county website usually have a lot of mental health resources. For one, I can speak for Wake County because I participate in a lot of their events. So I know Wake County provide rich resources when it comes to mental health. Okay, so these are the where you can go to find them. And know your rights as immigrants. I think that's very important for us. So first of all, we already talked about like, okay. You have the right to emergency medical care regardless of your immigration status. The federal law mandate that anyone, regardless of your documentation, or in other words, immigration status, receive stabilized treatment for life-threatening conditions, including psychiatric emergencies. All right, so then the language access interpreter entitlement. So you will be provided with the language assistance if you use federal facilities. All right, confidentiality. So HIPAA is acronym for a law to protect your confidential information of medical records. Because once you go to a doctor, what they ask you to fill out your name and date of birth and contact information, street address. So all the private information is in your medical records. So the law protect your privacy. So if there's no unauthorized disclosure, and therefore you don't have to worry, oh, if I see a doctor, then my privacy will be disclosed. So that the law protects that. And then non-discrimination guarantees. The healthcare facilities, they cannot deny service because you're certain race. They cannot deny service based on your color, your national origin, or your immigration status. So they're required to treat you no matter who you are. All right, and then the mental health care does not affect your immigration proceedings. So people may say, oh, I'm applying for green card. If they know I have like a mental health issue, will they deny my green card? So that's something, seeking therapy or medication is not considered a negative factor in your immigrations. Make sense? Okay, so this I'm talking about, this is one example. We talk about here where we're oh okay, community healthcare centers. So I'm going to talk about one example. Like I work for this organization. Again, it's nonprofit, and so they don't charge. They provide a lot of cost-free services like these, this called, for example, these are the few services they provide called mental health first aid training. They provide it for free. They have a documentary called Silent Wall. It's a to destigmatize the mental health issues or obstacles among the Asian community. And they provide education workshops, those are for free as well. So they provide a lot of free resources. I'm just saying there's examples of organizations like this you can check out in your community. Okay, then this is my last prepared slide. And so, oh my goodness, it's already this time. Time flies so fast. Okay, so basically you deserve good service and you're a part of a supportive community, and seek help. It actually shows resilience, shows strength, not weakness. Okay, any questions? I'll stop sharing so I can see all the questions in the chat box. I'm going to provide, after this, I'm going to provide you a sheet of resources because that's too many to list on the slides. If I list on the slides, the font will be so small you cannot see it. Okay, let me see the last question. How does mental health access differ between individuals with employer-sponsored insurance and those purchase their own plans? You have access to all. It's just the cost is an issue. Some insurance plan cover more. In other words, you pay less out of your pocket. Some you pay more out of your pocket. So to answer this question, the difference is how much you have to pay out of your own pocket. All right. The next, if someone is undocumented, what rights do they have or get mental health without risking their immigration status? We already addressed this in our like presentation. If someone doesn't make much money or isn't, how can they still use the ACA plan to get mental health care? Check it out. As I said, it tailored to your income status. It depends on how much money you have. So I would suggest you check it out. And you don't have to be a US citizen. And next is, how can therapists ensure that treatment approaches respect? Yes, so you check out the therapist. If you found that the therapist violates your values, you can report that. And what barrier exists that different coverage levels that affect access to early mental health intervention? Usually the barriers are financial barrier, culture barrier, or you don't know, but it's the knowledge, right? That's what this workshop for, to inform you so you have the knowledge to know where to seek help. All right, one last minute. I'll give it to our host and hostess. I don't know whether we run overtime or something, so I'll leave it to our host and hostess.
No. Charissa?
Yes. Give me this one. I have another one question last. If someone doesn't make much money or isn't a US citizen, how can they still use ACA funds to get mental health care?
Yep. So ACA does not require you to be a US citizen. It may require certain immigration status though. So check it out. I know people that have low income and here on certain visa, and they enjoy this ACA plan.
Yeah, great.
Closing statement, Charissa?
Yeah, so no more questions.
All right. Well, thank you so
Actually,
much.
we have a lot of question and chat box.
Uh-huh.
So maybe our time is not enough. So I will ask Mr. Shapur and Ms. Farada to send mostly our questions to you through email, so we
Okay.
can get answer more. Thank you. And
Right. Thank you so much for the opportunity to get
yes,
connected with you and
Thank you.
to use my limited knowledge to support my fellow immigrants.
Oh, it
yes,
was very professional, knowledgeable.
yes. So thank you all for being us today. We hope the information shared in this session was practical and helpful in navigating mental health services in the United States. Our sincere thanks to Ms. Grace for her time, expertise, and compassionate perspective. We would also like to extend our special participation to Wake Country and sponsor for this program for their generous support and partnership. Thank you for all the participants for your presence and engagement, which made the session more meaningful. We look forward for continuing these conversations in the future programs and creating more space for learning and connection around mental health in our communities. Wishing you your health and well-being, and thank you for your attention.
Thank
Thank
you.
you,
Thank you
Ms.
very much.
Grace.
Thank you. Thank you, Mata.